Tandem Diabetes has a packed pipeline, from a tubeless wear option for Mobi insulin pump users to the FDA-cleared 7-day SteadiSet Infusion Set, which will be compatible with all Tandem pumps, including the tubeless Mobi. And today we're getting a first look and demo. But it's not all future tech. Tandem has also issued 2 new safety warnings, including one that could deliver unwanted insulin. If you're a Tandem user, you're going to want to hear this. Welcome to the show. I'm Justin. I have type 1 diabetes, and on here I talk all things diabetes tech news and research with industry leaders, physicians, and those using the tech themselves. Joining me today is Ben Marr, Tandem's Senior Director of Product Marketing. He shares some insights on those warnings. He demos the 7-day infusion set for us, and he also gives us an early peek at the tubeless Mobi patch application. I cover up his camera for that, but you can hear my questions and also watch my facial reactions if you're watching on YouTube. We also dig into Tandem's upcoming Android app, the wider device rollout outside the US, and updates on the t:slim X3 and the Sigi tubeless pump. This episode is jam-packed, and it's got me so excited for what's to come. Keep in mind that anything you hear on this podcast is not medical advice and is for educational purposes only. Always consult with a physician before making changes to your healthcare. All right, let's get into it. Ben, welcome to the show. This is the first time that we meet digitally. We see each other at all the conferences, but yeah, welcome on the show.
Always nice to see you on video, I guess.
Yeah, it's a totally new experience. You know what I realized as I was writing these questions, I was like, wow, I'm a terrible person. I've never asked you like your story. Can you just give me and my listeners a quick little blurb on like how you got into this whole space?
Yep, sure. Well, my background and how I got to Tandem is essentially I've always been involved in medical devices. I actually started my career in Australia, working for a company called ResMed. They make medical devices to treat sleep apnea, and they sort of started there, and then I was able to sort of transfer across to the US. So I've always had a passion for medical devices and technology in particular within medical devices and how they actually help people. And then I came across Tandem. I was based in San Diego about 5 years ago, and to me it was just amazing, like looking at how technology intersects with med devices to help people with diabetes, and it was a pretty amazing story. So I was really interested in Tandem, and then I was really interested in working in the industry. My claim to fame is I actually got the job offer on the day that Tandem got clearance for Control IQ back in 2019. So
Wow.
I like to say internally it was two big bits of news that day, but then my manager tells me that one of them was great, one of them we're not so sure about yet. So
Yeah.
that's it. So that's my
Yeah.
Tandem story.
Yeah. And I just realized as you were telling me that you have been on my channel before though, because we did that video at CES.
Yep.
Which you told me someone came up to you and was like, I know who you were. You inspired me to get Mobi.
Yep, that's exactly right.
I love
We were
that.
about to launch at launch Mobi at CES, and we did a quick video, and I mean it shows you how engaged the community is literally a month later when we started selling it, someone said I got on Mobi because I saw you on the video. So that was when I was picking my son up from preschool. It was a pretty cool moment for me.
You're a star. Did you see I put out a Tandem Mobi review? Did you happen to see that?
I sure did.
What do you think? What did you think of what I had to say?
Well, I appreciated your honesty and the personal aspect of it. I know obviously your background, and I know of the challenges with that you personally have with the tubing. So that was obviously something that we're aware of, and we like talking about it. But we are always happy for people to share their story and talk about what works for them and what doesn't work for them. We see lots of people that are having such great success with Mobi. I know you had some challenges, but I think that's also just speaks to the personal nature of diabetes, and why choice and being able to personalize and customize your diabetes measurement is just so important.
Yeah, it's so subjective. Everyone's going to have a totally different experience with every system. And I'm very honest in the fact that I only used it for just under 3 months.
Yeah.
I think it takes about 3 months to get a system fully down and be like, I'm confident in this algorithm. My educator helped me get the settings, and I didn't get the settings where I needed
Yeah.
to, and I know I would have. It would have happened. It's just it was going to take me a little longer. And the tubing, obviously, not something that could have been fixed, at least on the model I was using. But we'll be talking about a future form factor that does kind of solve that. Will solve that for some people.
Yeah, you're exactly right, and we hear that a little bit, and obviously on the form factor, and yeah, that's unfortunate with Control IQ. If you get your settings dialed in, and we see this all the time, we see this from people that use it, and then people that so a lot of the clinical studies is if you have those settings dialed in, which doesn't take too long, you get results pretty immediately, like from day one, and it's really broad. So. Yeah, if the setup and then usually you're good to go. So I'd be excited for you to try it again, and maybe with a tubeless form factor when that's ready.
Well, yeah, I hope I can, because I already went through the period of like using it, and then I took advantage of like the return policy that I was offered. But like I want to try, I want to try it again now with this new tubeless form factor. So we'll talk about that. So I want to start off with a couple warnings that Tandem put out. I just want to clear the air. I want to give you an opportunity to speak on those,
Yep.
because we put them in our recent newsletter, and like so many people engaged with those links. So like I know my audience is tuned in on this. So let's start with the first one. There's the warning is unexpected automatic correction bolus delivery with G7 sensor during
Yep.
warm-up period in T-Slim X2 and Mobi. And from my understanding, this is like an overlapping thing when you're overlapping sensors. So what's happening there?
Yeah, that's correct. It's something that we discovered, and it's really unfortunate that happens if you've got an active sensor going and it's connected to your pump, and then you actually and this is something that's unique to G7, and it's a great feature of G7 is then you can start the sensor, and if you connect, there's this period of overlap when you're in warm up. If the old sensor's still active and the new one's in warm up, what we discovered, there's a risk and a concern that it can sort of, it's basically messing with the signals, and it can it results in a delivery of insulin. So we discovered it, and we wanted to be extremely sort of proactive. Safety is very, very important in this industry. So we sent out a communication to all potentially impacted users. And really, it's just reinforcing what Dexcom instructs users to do, as in wait till the old sensor finishes and then start a new sensor before you do that. If you do that, it avoids the potential for that issue occurring. So that's really what we did with that communication, is just to make sure that they follow the instructions and use it appropriately.
The Dexcom CGM allows you to do it, whereas Dexcom
Correct.
G6 didn't let you do that, right? So in a sense, Dexcom's opened this door to allow this. And then you have Tandem, who theoretically could install some software that doesn't allow two sensors to like come in. So like whose job is it to kind of fix it? Because people will obviously still be doing this.
Yeah, well, we hope not, because that's the
Potentially.
point of the
Potentially.
communication.
Yeah.
Yeah, and definitely it is absolutely on Tandem's responsibility. We are working on a software update that
Okay.
will be released shortly to make sure that that issue doesn't happen if people do sort of try and do that overlap. That's really on us at that point.
Okay.
It's an anomaly in our software that we found, and we're going to address it.
Amazing. Now, there's another warning that went out, which was like a speaker related issue with T Slim X2 pumps. So, what's going on over there?
Yeah, another unfortunate issue, and another reason what we did is we communicated proactively about that. The extra unfortunate piece of this is what happens is there's a malfunction malfunctions happen on pumps, and what malfunctions mean is it stops the pump operating and stops insulin delivery. The extra compounding issue here is it's a speaker malfunction, which is if the speaker malfunctions, it can't alert the user that the pump stopped working. So the speaker's not working, so it doesn't provide alerts and alarms. So that's an extra precaution, and that's a safety feature that is not alerting when this malfunction is declared. So again, we sent out communications to potential users, and we actually even sent out a press release to make sure that this gathered awareness. We're working on a software fix that'll help detect if this issue is going to occur. And we also instructed users to make sure that they're using the T-Slim mobile app, which can help provide extra information, as well as the Dexcom app. So they're getting their CGM alerts as well as part of that. So that kind of helps mitigate if the malfunction occurs and the pump stops operating.
Okay, great. Yeah, we'll put a link down in the show notes so that people can access these two warnings to see if they're affected, but they should have received an email. And that's how I found out about it, because people did receive this. So thank you for being so transparent. I know it's how important it is, and for, talking about it now.
Yeah, no, like we always believe patient safety it's first and foremost. So being able to communicate these issues is what it's important to us, and the FDA cares a lot about that as well. So we always make sure we take these actions very seriously.
On to something really exciting. You told me before we started recording that you have something to show us. So before you show us, though, so the SteadiSet, the new
Yep.
FDA cleared infusion set, this is a 7-day. It's cleared for 7-day use. So
hmm
how? Tell us why this can last 7 days.
Yeah, I'm glad you asked, because I'm really we've been wanting to talk about this for quite a while, and the clearance gives us the approval to sort of talk about it more broadly. So yeah, bear with me for a sec. So there's a bit of detail behind this, and I think people will find this interesting. So when we talk about infusion sets in general, like whether it's tubed or tubeless, so sort of just and the cannula technology underneath that, they haven't changed in decades. They've always either been steel or Teflon. And there's recent data to show that 97% of insulin pump users have had a site failure within the last 12 months. So virtually everyone has a failure. I'm sure it's happened to you, and it happens all too commonly. So the great thing about insulin pumps and AID systems is they're so great at helping to manage your diabetes, but at the end of the day, if you're not getting insulin into your body reliably, they can't do anything. So that's something that people have been asking for us to sort of make some improvements to our infusion sets, and we have been. So the SteadiSet is really aiming to sort of solve three pain points for users when we talk about infusion sets. And first and foremost, it's designed to be easier to insert. So if you've used some infusion sets, they usually take a lot of steps and a little bit of setup. This one's a 2-step process that you can put in. It's all in one inserter, kind of like the CGM insertions and the way they get put in. So that's one. It's a lot easier to use. Number two is they're reliable. So this is where the technology piece comes in, and this is where the cannula technology comes into play. SteadiSet has a completely unique and I'd say breakthrough technology inside of it. It is actually, the cannula itself is actually two parts and two components. On the inside, it is stainless steel, but it is coiled. So, and when I say coiled, if you can imagine a metal slinky, that's the best way to visualize it. It coils, but that means it's flexible, so it bends. So what that gives
Oh,
you
wow.
is the steel gives you the strength to get it into the body without kinking, but then once it's under the skin, it gives it some flexibility to move and bend with you. So the great thing about that is it minimizes the irritation under the body, because instead of being like hard like a splinter, it's soft and moving, and it's able to ideally reduce inflammation. And that's part of the reason why it can actually help you get to 7 days, because it's minimizing that irritation. The second part of the cannula is that it's actually wrapped in a soft material on the outside, which is also flexible. And the other part of that is it actually has 4 distal ports. So what that means is there's 4 ways for the insulin to diffuse into the body. So again, if you happen to get a blockage or an occlusion, there's three other ways for the insulin to deliver, and it actually is there's one at the end, and the other ports are rotated around the side, so you can't. It's not like they're all on the same side, so you might get a blockage on all three. It's also another way to deliver insulin and deliver it reliably. So that's really the technology underneath it, and this is what we're really excited to talk about because, like I said, is it's brand new technology, and it's going to make the intent is, and we've seen some of the clinical data that just got published. We saw during our clinical study, which was used to validate the submission and the clearance, was that looking at the primary goal of the study, and we saw over 3,000 sets were inserted over 14 weeks. We had a 94% survival rate, so 94% of sets lasted the full 7 days overall, which is like I said, is people have a lot of challenges
Yeah.
with infusion sets. Getting 94% of the sets to last 7 days is pretty astounding to us. So we're really, really happy with those results, and we're really excited. So that's all the technology underneath it that helps us get to like 7 days, an approved 7 days of wear with SteadiSet.
Now, yeah, 94% of them lasted that full time. I did get a lot of follower questions
Hmm.
about scar tissue.
Hmm.
How does this avoid scar tissue,
Yeah.
which can build up? They say you want to take your pumps off right now every 3 days. You don't want to go
Yep.
back to the same spot.
Yeah. So if you think about it, so like I said, the intent behind the cannula technology, the proprietary cannula technology, is to reduce inflammation. So the idea of that, reducing inflammation, reduces the chance of scar tissue building up. So that is the intent when people use this set over a longer time. That we believe that they're going to get less scar tissue over time. So that means they've got more sites overall that don't have the fatty buildup, which causes those challenges. And the other thing to really hit home is 7 days means you're halving the amount of times that you actually have to change a set. Um,
Exactly.
so therefore you have less changes to make over time, meaning there's less chance to build up that scar tissue in those sites.
Yeah, because right now, every 3 days, I'm putting on a new set. That means I'm using 10 spots on my body every month. Whereas
Right.
with this, you'd only be using four. So you're giving those
Or in a bit.
areas time to heal. So if you use a set for 7 days, does that theoretically mean it needs a little longer to heal? Or would healing time kind of be around? Do we know that?
I don't think we do know that. So what we
Okay.
know, so we use the clinical study data. What we know is there was high satisfaction in the sites, and that lasted uh, the full 7 days. So people were saying that they were happy with the site rotation, and then we also saw there was very little. It was less than 1% of people saying they had like abrasions or irritation, etc. So the reported amount of irritation was very, very low. I think, and again, I'm in the marketing team, so I'm not on the clinical side of things, but I think overall that sort of, I don't think we can specifically measure the amount of irritation and buildup, but the results from the users are saying they were really, really happy with the sets and how it performed.
Okay. And what about absorption efficacy? I feel like I've heard that it may even get better over the span of days. Is that true? Or like what have we seen something there with the efficacy?
Yeah, so what we saw, I mean, speaking of efficacy, we saw time in range by the end of 7 days was over 70%. So that was pretty comparable from the beginning to the end. And A1C, I think there was a zero point 0.1 difference. So the A1C over time was virtually
Okay.
unchanged. So that's what we were measuring, and that's what we were keeping an eye on. So again, we were really happy with those results. I will say this though, I mean, everyone's an individual, so you might have some people might work great. Some people it might not be perfect throughout the 7 days, but broadly speaking, we were really, really happy with those results.
All right. It's time. Can you show us
Sure.
the Tandem SteadiSet 7-day infusion set?
Yeah. So talk about ease of use, right? And if you're familiar with using sort of infusion sets, yeah, you'll see some improvements over time. So this is essentially how it comes, and this is the steady set here. So just to show it, it's super, super simple. You've got the tubing on top, and that's your connector, and this is actually the set and the inserter. I like to just usually when I'm doing a hands-on, I like to have fun with people and say, here you go, figure it out. Because I think it's that easy in terms of doing it. So like I said, it's a two step insertion. All you have to do, and there's little peel tabs here, is you peel off the adhesive covering and then place it on, and you have the two button press.
Wow, that was easy.
Yeah, right.
Way easier than it is now. It's also so small. That little
Yep.
set is very tiny.
Yeah, and that's the great thing about infusion sets is the on-body contact is so small, and it's so easy. So one of the other things that came out in the clinical study results as well is that we measured the pain on it, and we measured actually out of a scale of 100, and I don't know why they chose 100, but the average response was the pain level. So 0 being nothing and 100 being high, it was 5.
Okay. Okay.
So
Yeah.
5.
Well,
So it's virtually
that's why they
painless.
chose 1 to 100, because it would have been what, 0.05, and if they did the 1 to 10 scale, they
That's
were like,
actually
we
that's
want to get
true.
it at we want to get it as low as possible.
Yeah, there you go. Yeah, and then literally the easy it's literally a twist connector. So you put it on, and there's little guides to show when and you just twist it on and clip it on. And so therefore it's just really easy to take it on and off. So, and the benefits of this is this is also you can't see the needle. It's sharp safe, so the needle retracts. So this is really nice. And like I said, it's a one-handed insertion. So putting it on your arm, people with dexterity issues, the little ones who might have sort of some sensitivity to seeing needles, it's really great. And it's also an angled inserter, which we believe is going to be really, really helpful for people with lean body fat because it goes in at an angle, and then like I said, it's flexible underneath the skin, so we think it's going to be a really, really popular set.
Wow, so many upgrades here. What about tube length? Is there going to be multiple options of tubing?
Yeah, that there will actually. We have tubing lengths that go up to 43 inches long. So and I think I've got this one here. So we will have 43 inches. We'll have a 23 inch, and then for Mobi in particular, it'll be the 5 inch variety, so people can wear that on body as well.
Okay, so like, when can we get it?
Great question, and I know that that's what we are. So we're scaling up manufacturing on that. You can imagine, even though it's 7 days over 3 days, the volume that takes to build up. So over the next few quarters, we're going to be doing that, and sometime in 2026, we're going to be releasing that in the US and then other international countries to follow that as well. So we'll keep you updated as we get closer to timing.
This episode is sponsored by Omnipod. As someone with T1D and with an incredibly active lifestyle, it's important for me not to get tied up, especially with tubes on my insulin pump. I love to go swimming, lift weights, and play kickball with friends. And with Omnipod 5, I never have to worry about tubes getting in the way. Plus, not having to disconnect helps me to stay in range during all of my favorite physical activities. That includes sexy time too. See if you're eligible for a 10-day trial by visiting omnipod.com/diabetic. On there, you'll see full safety and risk information and trial terms. That's omnipod.com/diabetic. You're also working in the 7-day set technology to the upcoming tubeless Mobi form factor.
Mm-hmm.
So how difficult is that?
Difficult is, I guess it's a relative question. Maybe I'll start with how important it is for us. So so a couple of things about Mobi tubeless. Now we can shift onto it. One of the things is, yeah, we know that people there's many more people we think that use in tubed infusion sets right now around the world that do than do you tubeless. But we definitely know that there is a popularity, and we've heard it all along about sort of having a tubeless option. So that was really important to us. The other important thing to us is like I said at the beginning, the importance of choice. So what we have worked hard on when we say Mobi tubeless, if you think about our tubeless offering, all it is an infusion set option for Tandem Mobi. So you've got the Mobi pump in itself, And you can wear it, put it in your pocket. You can wear it on body with a 5-inch version. And now what we're introducing is a fully tubeless infusion set. So that's really where we're going. But then we realized, obviously, as we were working on SteadiSet and on the development there, we have the opportunity to put all those same benefits that we have with SteadiSet into that tubeless offering. So that's where, like, people have, like I said, I've been asking for 7 days wear overall. So essentially what we did is we used the cannula technology. So that same cannula that I just talked about is going to be available in the tubeless option. And the work and the development there is taking the tube version of it and attaching it to, essentially, it's a tray with an adhesive and the cannula underneath that. And again, on top of that, it has all of the ease of use of around the application, the reliability, being able the two-step and the one-handed insertion. Essentially, all of those principles will be built into the tubeless offering there. So that's the work and the technology, being able to basically take a tube version and applying it to a tubeless version. But on top of that, also having all of the great benefits you have with Tandem Mobi, as in the small form factor, the on pump bolus button, and the ability to disconnect as well. So one of the drawbacks of tubeless wear is you have to choose a site every 3 days, and it's there for 3 days. And the offerings today, you can't take them on and off. So for us, being able to wear it for 7 days, but also the ability to disconnect at any time, so you can do things like go into a sauna or a hot tub and not worry about that sort of stuff,
Mm.
is a great benefit to us. And then just the final piece is, anyone that's using Tandem Mobi today has the ability to, all they need to do is get a slightly different Mobi cartridge and then the tubeless infusion set, and they will be ready to go.
Okay, so just to repeat, people who are currently using Tandem Mobi will have the opportunity to just get updated accessories in
That's correct.
cartridges and these application patches, and then
Yep.
they're set. They can use this.
Yep. Yeah, and so my biggest sort of, what we hear is that conversation about tube versus tubeless. Why tube have to pick tube versus tubeless when you have the option of both?
Yeah, I'm excited to see the marketing. I know you're showing this at conferences. Like, I heard people talking about it.
Yep.
What are people's reactions?
They're really, really, really excited, because I think, like I said at the beginning, is the couple of things that we talk about is just the cannula technology and the SteadiSet set, and they see that, and people that have been using insulin pumps, they're just like, please, I can't wait for this, because that's kind of the Achilles heel. And then they see the Mobi tubeless offering, and they realize that same technology is there, and then they realize that, and when we share the fact that it's just another infusion set offering for Tandem Mobi that's tubeless, they're really excited, because they, like, we do see the appeal, we see the want for people to have those options and have those choices to sort of manage their diabetes.
All right. Now, I know you have one of these tubeless Mobis with you, but you're not ready to show it yet. So what we're going to
Hmm.
do is we're going to keep my face on screen on YouTube so people can see like my raw reactions, and we'll just put up the render image that's available of tubeless Mobi as you explain it. So why don't you go ahead and give me a little walkthrough?
So here's the Mobi as it stands today. Here's Tandem Mobi, and you can see it's got just a cartridge on that as well. Really, so this is how easy it is to go from a Mobi with an infusion set to a tubeless infusion set. Is what we've got here is a modified cartridge, so it is slightly different, and you'll see that. And but you can see the fill process is exactly the same. So on the end of it, it's got the place where you put on the insulin vial.
So
All you
right
have to
now he's showing me that like the packaging it would come in and the tool you would use to fill it with insulin,
Exactly.
the new
This is filling the
cartridge.
cartridge. Exactly. The slightly modified cartridge with insulin. So you fill it to your level. So you take the old infusion set off, remove the cartridge of the tube variety, and you clip on the filled tubeless cartridge. and that's ready to go.
It's about the same size. The only
Hmm.
difference is that now on top of it, there's a slider that adds maybe an eighth, like 10% more height to it. I don't like about
A little
10
bit,
to
not much.
15% more height. I don't know the exact measurement, but I mean, it's pretty much the same Mobi, just with that new tool. And so
Yep.
then what? Now you have this new cartridge on.
So you've got a filled insulin cartridge, to your level, and then all you have to do is, so this is the applicant, the inserter.
Okay, so this inserter looks very similar to the SteadiSet.
Correct. Like I said, it's the same technology that's built into it.
There's adhesive, like a patch connected to it.
Yep. And so all you do, take off the adhesive, put it down, make sure the adhesive's on, and you slide it off.
Wow. So now I see the adhesive down with the tray, and there you go. You've got Mobi on it. And now underneath the tray, is there flexibility there?
Yeah. So if you can't really see this, but that's important to us as well, because
Yeah.
if you think about it, your skin is obviously concave and it's not flat, and so the ability for it to have some give, um, in there is kind of important as well.
Wow. Well, I am so excited for everyone to see this. It's really, really seamless what you've put together there, and I'm excited
Hmm.
to that everyone's going to have an opportunity to just have more choice with the product. So super cool.
Yeah, that's
Thank you
that's
for that.
exactly right, and you're right, and we took some steps to also make it a lot easier to use, because we talk about reducing burden. Physical burden is obviously something that we're constantly trying to improve upon, just so it's easy to use and easier to change those sets every time.
Timing wise for this, do you see this as something that's coming out alongside the steady set tubing, or are you going to do
Well,
like one at a time?
yeah, I don't have details to share on that. What I can say is, during our last earnings call, our CEO John Sheridan kind of reaffirmed that in 2026 our goal is to launch the Mobi tubeless offering as well. So
And do you still need clear now that you have the steady set cleared? Does that cover this patch steady set, or does that need its own clearance?
it needs a submission,
Okay.
as well. But again, using the clearance and the clinical validation data that was part of SteadiSet, our goal is to help that to use that as part of the review process and the justification for why this set should be approved.
Okay. Now, when it comes to rollout for both of these steady set applicators and the new form factor, how will rollout look getting these out to current users of Mobi and T
Hmm.
Slim?
Yeah, well, I mean, our goal is to make it as simple as possible, and it's just another option for people to get their accessories. So usually every 3 months you get your supplies of cartridges and infusion sets, and it's not like the other infusion sets are going away. There's a lot of popularity in those sets, and people like them for various reasons. So this is just like, when it comes to get their 3 month supply, wherever they get it from, our goal is just to make it available so they can then choose to change to SteadiSet, or even use the Mobi tubeless offering when it's available, or they can stick with their current infusion sets if they like that too.
Does SteadiSet still need CE mark? Does it have it, or is that something that's you still need to do?
Great question. So that's, yeah. So right
Which is
now the plan
clearance in
is,
Europe, and
yeah.
other areas use it as well.
Great question. So right now it is FDA cleared only, and when we said we'll make it available in 2026, that'll be in the US to start with, but of course we want to roll it out to other countries over time.
Great. Yeah, I love living in the US when it comes to diabetes tech.
Yeah.
And I also like accessibility, like, is really tough uh everywhere. And I understand also you only have so much power and money to be able to do these
Hmm.
things. So I understand, the reasons behind why
Yeah.
it takes so long. But I am hopeful that everyone can get to use these instead of just listening to how cool these things are. Let's get into CGM integration. You've got a bunch
Sure.
of updates here. Libre 3 Plus support came to, or is coming. I feel like it's coming like this week or something. I heard T-Slim is getting Libre 3 Plus. Is that here? This comes out on Monday. So in relation to this being out, when can people expect that use T-Slim?
So with T-Slim and the Freestyle Libre 3 Plus sensor, we actually have an early access program running now. So we
Okay.
have a select amount of people on it. We do plan to make it more like widely available for anyone that's using T-Slim today in this year before the end of this year. So that'll start in the US, and then we will start actually, our goal is to, when we talk about access and availability, our goal with that sensor is to make it accessible in the majority of countries. We offer it really quickly and shortly as a stage rollout pretty quickly after that.
Oh, that's great to hear. Follower question: why is CGM support staggered between your own systems X2 and Mobi, right? So T-Slim
Yeah.
has this Libre 3 Plus integration already happening, but Mobi, which is actually a newer pump,
Hmm.
doesn't yet. And
Yeah.
I don't know if I've heard anything about it getting it. What are your plans there, and why is it a staggered approach when they use the same, pretty similar technology and algorithm?
So the plan for Freestyle Libre 3 Plus on Mobi is as soon as we make it available widely on T-Slim X2, the goal is to get and release Mobi shortly after that. So the reason it doesn't necessarily, it can't always happen at the same time is while we do actually have a lot of shared DNA between the two different pumps, there are also the differences, and it's the differences that mean that we can only really work on one thing at a time. The reason we really chose T-Slim to go first is just because we have just a much larger user base at this point using T-Slim X2. So being able to make it more available to a wider group of people was the choice that we made. But we absolutely know that we want to provide all of those great CGM offerings, and so people can choose which CGM works with which tandem pump that they want as soon as possible.
Yeah, I've actually been testing out the Libre 3 Plus.
Hmm.
I'm going to be reviewing it, and that's going to go out on YouTube in the next few weeks. And yeah, I've really been enjoying it, and it would be cool to loop with it to get automated insulin with the Libre sensor on some pumps. So that's something I definitely want to try, and my review will definitely be like a two-parter, because the second part will really be like, well, how does it perform with pumps, right? So I am
Hmm.
gonna try that out next in the part two review. The thing about Libre sensors, at least right now, and I believe they are working on this with their technology on their end, is that it only connects to one device. Meaning, when Libre 3 Plus or 2 Plus are connected to your system, there is no follow feature for parents or caregivers to see. And your Mobi pump is cleared for 2 years and older.
Hmm.
So, but I just don't know if I could see a parent having their child on Mobi wanting to loop it with Libre 3 Plus unless there
Yep.
is a follow app. So, do you plan on building a follow app? Are you working on one already? Like, what's going on there?
That's a really, really, really good question. We actually already have a follow app that's
Oh,
available today called Sugarmate by
oh,
Tandem. So if you're, yeah, if you're,
oh,
yeah, so if you're aware, sort of, we've had Sugarmate
yeah.
for quite a while. Right now, it connects to Dexcom only, but our goal is to essentially make that available where it connects to your Tandem, your T-Slim X2 pump, or your Tandem Mobi, and then provide the follow capabilities, as in users can follow and get sort of regular updates of the CGM readings, and ultimately we want to build in the insulin data as well to that. So that would be our solution
Okay.
that we would provide if you're using an Abbott sensor. You would be able to, and it's not available today in terms of follow, but we are working on that one.
Yeah, I use the SugarMate app myself. You can use it to see your glucose levels on your computer, at least on Mac,
Hmm.
in the top taskbar. You
Yep.
can have it sent to your calendar, so you have like every 5 minutes a new calendar in event that also can be seen on Apple CarPlay. Does
Hmm.
SugarMate integrate with Android devices?
We actually just, I think, last week launched the Android app for Sugarmate.
Amazing. Wow. So you're real. I love all this
We're working
innovation.
on
This
it.
is so exciting. Yeah, no, that's great to hear. So you've got Android support there so that people will have follow and already do with Dexcom with Sugarmate. So it doesn't matter what device you have. Do you have any idea on timing for the Sugarmate working with Libre sensors?
Not that I can share today. As I said, we're working really hard on that one, and obviously we do hear that feedback to make it available. So as we get closer and we have more firm details, we can share that with you.
Okay. Now, there was also a partnership with Abbott with their ketone sensor or their dual glucose ketone sensor. So this would be a next gen sensor coming from Abbott that measures both analytes. Why was it important for Tandem to partner on this, or to announce a partnership that you would utilize these or integrate?
Really great question. I mean, I think at the end of the day, the value of being able to monitor glucose and ketones is really important in insulin pumps in particular. One, we have the technology, and two, it's more data that we can use to help either inform people or actually even potentially make improvements to our AID systems over the longer term to be able to have those that extra information. That's potential that we'd love to explore and see if that can make it further improvements to automated insulin delivery over time. So really, I mean, it's the potential to both near term and longer term of being able to get that extra data.
Great. And when it comes to the Eversense 365, the implantable continuous glucose monitor, it has ICGM clearance, so it can
Hmm.
work with pumps to automate insulin, and they have their first pump partner with the Sequel MedTech Twist pump.
Hmm.
What about Tandem? Is Tandem looking at Eversense? Is it considering it? How difficult is it to implement?
Well, yeah, so speaking about that, what I will say about CGM integrations is they are very difficult because they're kind of like custom implementations. Even, there's differences between G6 and G7 and Freestyle Libre 2 Plus to Freestyle Libre 3 Plus. They're all kind of custom implementations that we have to do. And then there's all the testing to make sure the Control IQ Plus works, and the CGM readings and the alerts are all getting in there. So it is a lot of work. The way we look at it overall is if people are asking for, and people ask all the time, they want to use the sensor that they've chosen to use or their healthcare provider recommended. They want to use that, and then they want to use it with the one of the greatest benefits is Control IQ Plus. So being able to then integrate with that is something that's important to our users. So anytime there is demand and people are asking for that, we're always looking at ways to do it. It just doesn't always happen overnight, and there's obviously things that we have to choose and prioritize, but we want to provide choice. We want to provide choice to people to manage their diabetes.
Great. Well, you heard it, people. If you want it, flood Tandem's emails. Sorry. Cool. Well, let's talk a moment on some other devices that are in the pipeline or possibly in the pipeline. Are you still working on a Tandem T-Slim X3 pump?
Yep. Yep, we are. And I don't have a lot of details to share, but what we've sort of announced is, yeah, again, the T Slim X2 is sort of our original pump, and it's people love it. So we of course want to continue to provide that option. We're working on an X3. It's got updated internal components like CPUs, et cetera, and also external components. So similar form factor, but just an updated hardware and software as part of that, so people will be able to continue to use that form factor over time.
Today's episode is sponsored by T1D Exchange. You can directly make an impact on diabetes healthcare, treatments, and technology by participating in the T1D Exchange registry. It starts with a simple survey about your life with T1D, and it only takes about 15 minutes. After that, you'll have a personal portal with ongoing T1D study and survey opportunities. Plus, some of these studies even offer compensation. Signing up with the link in the show notes helps support my channel, and it allows me to continue putting out free content. You can sign up at t1dexchange.org/diabetic or click that link in today's show notes. You're working on a third pump at the moment, the Sigi pump, which Tandem acquired AMF Medical in 2023, a company that was working on this Sigi tubeless first pump. This pump was designed to be a tubeless pump. It also received breakthrough device designation from the FDA in 2021, which means that it gets streamlined in a way through approvals. Now, where is that? And how streamlined is it if it's been 4 years? And,
Yeah.
kind of what's expected there?
Great question. So we haven't, I don't have any timing to share, updated timing to share, but really, obviously, that is still something that we're working on, and you can see, just sort of the trajectory we're going in terms of offering. So we have, like I said, we have T Slim line, which is an all-in-one pump that uses infusion sets. We have Tandem Mobi, which then is that like convertibility factor, as in on-body wear with an infusion set, and we're working on the tubeless offering. And Sigi is a tubeless only version of the pump, but it also then has that similar DNA that we have, as in it's durable, and so those components are reusable, and then it's the other part of it that is the ability to disconnect as well. So it's not just on your body for how long the infusion set lasts for. So we see that broad spread between and choice that we want to offer to those people, and that's kind of how we're segmenting those offerings.
Yeah, and I know that at least the form factor that I've seen and spoken about on my channel, we've got a video on it, is that it uses cartridges of insulin similar to what you see with like smart insulin pens.
Yeah.
Is it still going to be using that? I assume so. And then how many units of insulin is that holding?
Yeah, so those are the ones you've probably seen, are those pre-filled insulin cartridges. I believe it's 160 units it is, but you can imagine the reason for that is just the ease of use of being able to not have to fill a syringe, like get a vial and fill the syringe and then fill a cartridge. It's just being able to put it in, plug it in, and go. So that's really the intent behind there.
I assume that this would take advantage of your 7-day set. Why go backwards?
Yeah. Again, that probably don't have the details to share on that one, but yeah. I mean, you can see sort of the need for people, and what they're wanting for is obviously making the change process that much easier and less frequent.
Yeah, and this kind of goes for both Tubeless, Mobi, and Sigi, and maybe you have to answer this separately, but it is a 7-day set, but some people will need to switch out these insulin cartridges and refill within those 7 days. When you do that, I imagine you leave the patch on, you put in the new insulin, it primes in some way, and then you just pop it back on.
Right. That's essentially right. So you can change out your cartridge and have more insulin, but you still don't have to insert a new infusion set, put in a new cannula under your body. That is every 7 days.
Okay. Let's move on to Control IQ Plus, which is here in the United States. I got a chance to use it for a little while. It's funny, during my review, I saw the before and after, because when I started Mobi, that wasn't available, and then it came out a few weeks later. I was like, wow, this is good timing. So I saw the changes. You brought in an extended bolus up to 8 hours. You brought in temp basal within auto mode. So what that is it allows you to switch your insulin percentage or dosage. So like you can get up to, what is it, 200% more insulin, or 250, 200, and then you can get all the way down to 0% less insulin, right? So what I did, and it stays in auto mode, which is where like the true magic of a feature like that is. So when I was going to exercise 1 hour before, I would turn that on, reduce my insulin needs, and then the extended bolus, that's like, fattier foods, you can have it extend over time. So how is rollout going? And do you or will you have data to share on the results you're seeing? Like when will we see that, if it's not already available?
Well, we actually, the Control IQ Plus algorithm is what we actually use to, that was the clinical data study that we actually used to get the age indication down to 2+, and the type 2 indication. So we actually published those results, and it was actually published in the New England Journal of Medicine as well. showing just actually the benefits of Control IQ Plus there.
Okay.
And really, the exciting thing for us to see there was just how well it works across such a broad population of users. You can imagine the insulin needs for a 2-year-old um, compared to the insulin needs for a 65-year-old with type 2 diabetes as just so different, as well as their habits in terms of how they use their insulin pump and how they interact with it. It was just so different. And what we saw is no matter what, you see results from day one, and it's usually on an average at 10%. Sometimes we saw up to 18% time in range improvements being able to use
Wow.
Control IQ Plus.
Okay. I forgot to ask you a question earlier, and this is important to me. So when I was trying out Tandem Mobi, a thing for me that was annoying was that every time I showered and had to take it off, I would go and grab my phone and stop delivery of insulin. And like, I was like
Hmm.
naked and ready to go in the shower. And then I was like, oh shoot, I have to run out. And then like I had a roommate. So I was like, let me put on my shorts. Let me go find my phone, whatever. Is there currently, and I missed this, or will there, or could there be a way to stop insulin delivery with the bolus button? Could you program the bolus button to have that feature? To me, it seems like it would be a really helpful feature, and I would love to see that even on tubeless Mobi.
Yes, that is all possible, and that's actually a really nice idea. I haven't heard of that one before, but I think, I mean, that button itself is a multi-function button. It does multiple things, not just bolusing. So
Yeah.
you can program it away. You just need to obviously build it and then validate it to make sure it works. So we'll share that with our engineering team.
Yeah, I would love to see that because like having to go run and get my phone to stop delivery every time, and I know a lot of people don't do that. I hear like everyone's like, why would you do that? I was like, because I don't want the pump algorithm thinking I got an because it does the auto correction boluses. So if it gives me a big bolus, it's gonna think I had that, but I didn't.
And it's going to impact, yeah, affect your
Yeah,
IOB, and yep, yeah. I
yeah.
mean, yep, you
It'll also
absolutely. I
get
mean,
your
we
numbers down and your stats better probably. So could work out for
Yeah,
all of
yeah,
us.
yeah. We always recommend, yeah, suspend the insulin delivery when you're taking it off, as well. We do that, but I mean, that's also the good thing about Mobi is I mean, it's IP28, so you can shower with it and you can do those water activities as well. But yeah, do suspend the insulin when you take it off.
Algorithms we're using today are like 5 years old. We're
Hmm.
we're using old algorithms, and I know we're on the precipice of,
Hmm.
and it's cool that you brought out Control IQ Plus because it's like this middle moment for it. But like we're on the precipice of second generation algorithms. What are your hopes, or what do you imagine that next generation of algorithm could look like for people with diabetes?
Yeah, that's a really good question, and I can tell you what Tandem um, is doing about it is, and
Yeah.
we talk about fully closed loop systems. So right now, today, every single AID or algorithm out there is you have to announce your meal because obviously that increase in carbs is something that you need to tell the system to do. So our goal, and it's something that we're working like extremely hard. It's probably one of the top priorities in our company is get to that fully closed loop system, meaning you don't have to announce meals or regularly interact with it to adjust your insulin based on what you're doing, so it can cover all of those extra situations and like truly automate essentially 100% of your insulin delivery.
Now, in this next generation of algorithm, will the requirement be to just have it be when you're fully closed loop that the minimum time in range ideally is 70%? Or is there a way for us to also improve results with that new algorithm?
It's probably too early for us to get into too much detail for
Yeah.
us, but what I can say is that when we think about Tandem and our sort of DNA and what we do is like I said, it's choice, and being able to personalize and customize your management is important to us. So if you don't want to touch it and you're happy with 70%, that's great. But if you want to dial it in, it's something that we know users want to be able to do, and help inform the system to make it that much more accurate. That's something that we're passionate about as well.
Yeah, and I think something I didn't take advantage of when I was on Mobi, and I wish I had the chance, I'll do this if I tried again, is using profiles. I think that there's a lot of power in profiles, the ability to
Yeah.
switch between treatments just by switching profiles. I think that could have helped me in some areas using it.
Yeah, and yeah, we hear this all the time. No, diabetes is kind of different every day. So having that ability to kind of make changes and toggles and help the system along is something that benefits a lot of people.
Apps. Let's talk about kind of what's coming with there. So, is there any information on the Android app? I know, like
hmm
on social media, whoever is your social media coordinator was like commenting, "It's coming by the end of the year." Like, is that still happening?
That's still the plan, and
Okay.
we're on track for that one. So by the end of this year, we want to make Mobi and Android a thing.
And I can imagine Android is a really big need outside of the US, right? I believe outside the US, at least 70% of phones are Android, right? So to
Yep.
release Mobi outside the US and expect people to be able to use it, you're going to have a limited market. So is that also going to help you with expansion of your devices?
Yeah, for sure. And it's yeah, and yeah, exactly. And you're exactly right. Yeah, of course. And it's the same thing about, CGM compatibility. People want to personalize their diabetes, so they don't want to have to choose a phone if they want to use Tandem Mobi. They want to use their own phone.
Yeah, and I got so many questions about availability outside the US,
hmm
whether it be, I mean, I had people from UK, Canada, Ireland, Australia, and all over Europe messaging me like, when is this available? So I know that this is a lot, right? But when it comes to, let's start with just the, because we're on apps, the T Slim X2 iPhone app, which is currently out. Are there current plans or announcements with expansion outside the US for that?
Yeah, we actually we are in the stage of rolling it out outside the US. I think we're
Okay.
up to 6 countries already. Australia's one of them, UK another, and Israel's another one. So we actually have the app available in many countries. It's going, and we're trying to make it broadly available as like over the next number of months. So that's something that we're working on the T Slim side for sure.
And then Control IQ Plus, what about that?
Same thing. And again, these things all don't necessarily happen at the same time. It's kind of sequential. But again, I mean, making improvements to our algorithm and control IQ, rolling it out. So right now it's available in the US only, but again, like towards the end of this year and into early next year is the plan to expand that more broadly.
And then I know a lot of people are curious about Mobi. I know your T Slim is out in a lot of places, but Mobi not necessarily in the same location. So kind of what is that looking like?
Yeah, so again, we're actually planning to launch that outside of the US towards the end of this year. So we're feeling good and we're on track of that. So that'll begin the rollout. You can see you're asking me all these questions and it makes me realize how busy we are with all of these expansions.
Yeah. Well, and I had a really good follower question with all this is like, do you have any insight on why this takes so long to bring these things out?
Well, there's like development work that has to happen, and then testing. So that's on our side. Changing like units of measure, going from milligrams per deciliter to millimoles is something that we have to do, and we have to do it on apps and on the pumps itself, and then the translations as well. It's not. It might not seem that hard to sort of translate it, but making sure it's accurate and providing the right information and validating that, and then it's not just one language and one unit of measure. We're testing and verifying that it works in multiple ones of that, and we're talking dozens here. So that's the extra work that it takes to develop. And then you have the regulatory side of things. Each regulatory body wants different information to validate that it is safe and effective. So there's all of that work, and there's testing, and there's the paperwork and the documentation to sort of um, validate that, and then we use that as part of the submission. And then there's timing. So that's
Yep.
some of those things of the reviewing those submissions are out of our hands. They're in the regulatory body's hands, and they take time as well.
Yeah, I know regulatory can really slow things down. And we just had an episode last week with someone who's worked with the FDA and knows a lot about what's going on right now and also is actively working to come up with universal, streamlined avenues for getting things cleared faster so that Tandem and other companies can utilize these systems to bring out these updates sooner and upgrades as well. Is there anything on the Tandem side that Tandem is implementing to make things faster?
I mean, we always want to. So yes, but I mean, what you just said would be fantastic if we can simplify the process. We also work on thinking about ways that we can do sort of things up front and do it from a global perspective. So it might take us a little bit of more setup, saying, okay, the FDA is looking for this, and CE markings looking at this thing. So we do it up front. So then, therefore, we might release or submit to the FDA first. But then we know we've already got the documentation and the testing and the validation done to help us make it a faster and smoother process. So it's a little bit about processes just to make them run smoother and easier.
Awesome. Well, Ben, thank you so much for coming on the show. This was an overload of information, and we got some goodies too. So I'm looking forward to hearing what everyone thinks. And make sure everyone, you need to watch this because we saw some good stuff. So yeah, thanks for coming on the show.
Thanks for having me on, Justin.
Thank you so much for listening. What are you most excited for from Tandem? Let me know in the comments, and make sure you're subscribed to this, whether it be on YouTube or on any podcast platform. You could do that with the link in the show notes. I'm Justin. Thanks for watching, and I'll see you next week.